Hi, my name's Sydney Helsel, and I'm here to talk to you guys about my medical word report. So, the articles that I chose deal with the hepatic system, or as many people know it as the liver. I'm going to explain my three articles, the facts that I found interesting, and my reasons for choosing each article, and then I will end each one with summarize it. So, here we go. The first article that I have is titled Hepatic Steatosis, a quantification by protein density fat fraction with MR imaging versus a liver biopsy. So they're comparing the ways to detect hepatic steatosis, and what they are really comparing is the invasiveness of it that liver biopsy has versus the MRI, which the patient will just go into the machine, have the images run, and then they'll be able to see if they have the hepatic steatosis occurring. So the reason why I chose this article was because I'd never heard of the term hepatic steatosis before, and it made me want to know a little bit more about the diagnosis because I was looking into liver diseases. So I took a little bit of a deeper look into it, and this is what the article had told. This is what the article had I had found to be interesting about it. So the term hepatic steatosis means an abnormal or excessive accumulation in intercellular fat within the liver, and this is associated with obesity, insulin resistance, hyperlipidemia, and cardiovascular disease. So having an unhealthy lifestyle can lead to this hepatic steatosis occurring because insulin resistance and obesity and hyperlipidemia can be corrected with proper diet and exercise. This disease can lead to liver cirrhosis and the comorbidities and mortalities that go along with that. So, many people who are diagnosed with liver cirrhosis do end up either dying from stage 4 or needing a liver transplant. So, that has a lot of the waiting list for transplants are high. So, the likelihood of a transplant occurring is pretty slim for patients. An interesting fact that I found is that hepatic fibrosis, which is the thickening and stiffening of the liver, and the hepatic iron levels affect the MRI's accuracy in diagnosing the hepatic steatosis accumulation. And then to summarize this article, because it is a lot to take in, the protein density fraction paired with MRI is able to provide a non-invasive and fairly accurate estimate of the presence and gradings in patients with non-alcoholic fatty liver disease. So my second article I chose was simply titled Liver Cirrhosis. And the reason I chose this article was because I have a family member who is recently diagnosed with liver disease, and I wanted to know a little bit more about what he's going through. An interesting fact to start it out with is that the 14th leading cause of death around the globe is liver cirrhosis, and it's fourth in Europe, which is pretty high up for them. The main cause of cirrhosis in developed countries is due to hepatitis A or B, alcohol abuse, so having alcoholism, abusing alcohol, drinking it more frequently, and other conditions related to non-alcoholic liver disease. Something wild is that the initial stages of liver cirrhosis are asymptomatic, which leaves the disorder undiagnosed, which assumingly gives way to increased damage to the liver because the patient is still proceeding with old habits that may damage the liver, like drinking. Common symptoms that are associated with a decompensated liver include ascites, which is fluid accumulation around the abdomen, sepsis, variceal bleeding, encephalopathy, and jaundice, which is the yellowing of the skin or sclera. Testing and examination used for diagnosing cirrhosis is as follows, which is using an ultrasound, CT scans, or MRIs paired with liver function tests, so LFTs. To summarize this article, liver cirrhosis can be prevented and managed through IDing the patients at risk and performing early screenings, keeping up to date on your vaccinations for hepatitis B or C, maintaining a healthy lifestyle, not smoking, making sure if you are drinking in moderation, screening for gastric and esophageal varices and cancers are an early detectors for liver cirrhosis. And treatments for liver cirrhosis include the DASH diet, diuretics, and if all fails, a liver transplant. And some have, when you have your blood cleaned, like I was saying, when a patient is going through dialysis, they could also be cleaning their blood that way, and it could help with their life expectancy. But when all else fails, a liver transplant is what is turned to if the patient is qualified. So early diagnosis helps prevent the progression of the disorder as well. My third article is an article that is used to determine the factors associated with hepatitis C infection in the rural areas of the Appalachian in Kentucky. So I know it may seem kind of far-fetched and that's kind of out of nowhere from Kentucky, but I live in a small town where hepatitis C is prevalent because of the injection drug users and the abuse that's occurring around here. So I kind of wanted to look into it to see what was happening in my community. And it has always really puzzled me on how each hepatitis or hepatiti have different ways of transmission besides a couple. And it got me really interested that since I was doing my word report on the liver, why not look into it? An interesting fact that hepatitis C, 40% of cases annually are linked to injection drugs, and that many other routes of transmission include tainted blood and blood products, intranasal use of injection of drugs, sharing straws, cigarettes or crack pipes, and sexual intercourse. Risk factors include being less educated or an older adult. So in being less educated, they would not know of the resources available to them in the community that where they could have clean syringes or help with getting clean along those lines.